My name's Reagan, and I'm here to talk to you about RestoreFx. I graduated from this program last year. I was actually injured at work, fell off a ladder.
What were you like before you were in the program?
Well, dealing with the insurance company, dealing with the doctors all the time, the constant pain, to the point where I would sleep for 12, 13 hours a day, get up, and I'd just be dead tired. I could hardly even move the blankets off of me. Didn't think I'd ever work again. There's no way. I withdrew from my family, and my friends, all my business contacts. I just didn't want people to see me like I was. And then my doctor said to come to RestoreFx. RestoreFx, I started looking into the program, and at first it seemed really undaunting. It was 8 hours a day, 5 days a week, and I just couldn't imagine getting up, getting dressed, and going there every day. But once I found out a little bit about it, here are some different things that they do. First off, it's physical therapy. Well, physical therapy, they measure you, they test you, and then they design a exercise program just for you. It's pretty slow at first, it's just nothing a lot, but then as the program goes on, they ask for more and more and more, and you find out you're able to give it. Then there's occupational therapy. Well, occupational therapy, they first sit you down and you do a budget, and you see exactly what it takes for you to get by. Then they look at your resume, and they create a resume based on what you've done in the past. And after that, it's like apply for jobs. And you're applying for jobs. They're getting you to go outside your normal box. You're applying for jobs that maybe make less money, but from the budget that you can get by on this. And so what that does is you apply for a bunch of different jobs, things that you thought you'd never do. There's yoga. Yoga, at first you think, no, there's no way, I can't even get up and down the floor. But then you say, okay, it's part of the program, so you do it. You go out there and you stretch and do different poses, and you start to feel pretty good. For a short period of time, you even feel normal. Also in occupational therapy, they go over the interviewing skills. Teach you, what you should say about your injury, about the big space in your resume, things like that. It's pretty neat. Then there's group therapy. Well, group therapy, you're in there, you're sitting in a room, and you got a bunch of people around you, and you start to notice that their story is pretty much like yours. And some of the things that they do to get by is pretty inspirational, and you kind of use that in your life too. So they even talk about nutrition. Nutrition is basically how you eat as much as what you eat. There's a lot I didn't know, but it really came to light in the nutrition class. Family therapy. Once a week or so, they bring your family in, and you really find out what they think about your situation and how it affects them. And it was surprising, to tell you the truth. They also did medical management, where they would look at your injury, and help you deal with the medications you're on, and really try to get you off as much medication as possible. Try to get yourself back, There was also one-on-one therapy, which one-on-one therapy is really nice because you're able to really let go of a lot of things you wouldn't really normally tell anybody. And then they try to point out what the root of the problem is. And once you get down to the root, a lot of your problems can be worked out. Also, this program stays with you. Even after you discharge, you're still able to do yoga classes. They give you home workout. And they even, I even got these little stretch tubes I could use to exercise my arms with. I mean, they give you printouts to tell you that, what stretches to do. So the program doesn't just, it's when you graduate, it doesn't go away. There's also follow-ups, 1 month, 2 months, 3 months, and then a year. So you're in here, you're taking tests, and they're seeing where your progress is, compared to other people. Another thing about all these different programs is everything is proven. They're not using you as a guinea pig on anything. RestoreFx taught me a lot of different things. I didn't quite agree with everything, but the things I did agree with and the things that did dawn on me really helped myself get back. I mean, now I've got 2 jobs. I got a full-time 40-hour-a-week job where I work with computers in a data center. I also got a part-time job where I'm doing sales for a voice-to-data cabling company. I've pretty much got myself back. I'm centered. That's the way I feel. Physically, pain's still there, but it's more of a background thing for me. It doesn't control me. It doesn't control my life. So, really, I enjoy things again that I used to. So, all in all, I would highly recommend anybody to go for it. I mean, at first you don't think you can, but by the time you get to the end of it, you're going to win. You're going to be a winner.